Hi, my name is Dave Troughton, and I'm a registered physiotherapist. I work at the Joint Replacement Clinic, and I work with people who have advanced osteoarthritis who are getting prepared for joint replacement surgery. I do preoperative education and assessments, and we help people to be in the best possible condition, so we call it surgical optimization. So part of that is educating people about joint replacement surgery, educating people about arthritis, and one of the things that we do here is something called prehab education, which is introducing the idea that you don't have to wait until after your surgery to start your rehabilitation. You can start your rehabilitation now. So that sort of is how we introduce walking aids as well, is you're going to have to use walking aids after the surgery, and why not start using your walking aids now? So when we work with people with advanced osteoarthritis of the knee or the hip, well, oftentimes they have arthritis in their back, or they have chronic low back pain or spinal stenosis, or they may have arthritis in other joints of their body. So yes, we do definitely work with people with back pain. And again, it may be asking the person, I actually, as an assessment tool, I ask people, when you go shopping, do you use a shopping cart? And they say yes. And I say, why do you use a shopping cart? Well, it helps with my low back pain. So as soon as somebody has said that to me, it gives me an idea that they would benefit from using something to take the weight off of their back. What that means is they're going to take the weight through their arms. And that's what leads us to this whole concept now of quadruped walking, which hasn't really been so much considered before. For example, you had not heard of the term prehab. I had never heard of the term quadruped walking in the same context. I've heard of quadruped walking for people who are disabled. Do you know what I mean? Like when I was in rehab school, I actually remember it now. There's tripod walking, there's this, but it was all in the context of people who had a disability. It wasn't really taught in the context, and which kind of seems crazy to me now. It wasn't taught in the context of ability. And so what I've learned from you is when you're 14 years old and you're told you can't do something, that just doesn't register. It's like, no, I'm going to focus on what I can do. I don't really care what I can't do. and I think it's introducing that concept to people who are in their 50s, 60s, and 70s, is let's take some of the emphasis now away from what you can't do, and let's start focusing and thinking about some of the things that you can do. And again, that's where it becomes more and more apparent to me that there's, as I said earlier, there's about 1,200 joint replacements done in Victoria each year. What that means is that there are a lot of people walking around Victoria with a limp. It's the worst thing that a person can do for their bodies, is to walk with a limp. For one, it means that they're not using their muscles correctly. So if you're talking about low back stuff, and every time you walk, your trunk shifts, that puts strain through the facet joints. It doesn't allow you to engage your core muscles, the spinal muscles that stabilize your spine. They won't be recruited properly because you're walking abnormally. But when you use a walking aid, it doesn't necessarily make you walk perfectly, but it certainly will help with your posture, improving the upright posture, but also it takes away that 2,000 to 3,000 times of shifting your trunk to the right. The other thing that does is for people with hip arthritis is the main stabilizers of your hip, which are your hip abductors, are not actually engaged. So if you walk with a limp, you're weakening your hip abductor muscles. If you walk with side sticks, long distances, you're engaging your hip abductor muscles. So when people say, well, it's really important you strengthen your hip abductors in preparation for surgery, they immediately think of hip abductor exercise strength. They immediately think of hip abductor exercises, which usually are lying on a bed and lifting your leg out to the side. My experience is that most people don't think of using side sticks to strengthen their hip abductors, because it will make them walk with no limp, which means that they will engage their hip abductors as much as they possibly can with the arthritic joint that they have. So when I tell people these, explain it to people this type of way, people seem to be more interested in making that kind of change, in starting to use side sticks or walking poles or a cane, because they see that they start to understand that it's for strengthening, it's for pain management, it's to help with their posture and all those kind of benefits that they would get from it. And they don't have to wait to have major joint surgery to get some of the benefits that they will get out of the major joint surgery, which is to walk with no limp.